Hey guys, Thomas here from Trainfuly. In this video, I'm going to show you why your upper back is hurting and 3 things you can do at home to stop your upper back pain and improve your performance. All right, so sitting and staring at a screen all day, along with using computers, cell phones, or tablets too much, can lead to a forward head posture with rounded shoulders and hunched upper back. This is referred to as upper body dysfunction, and it can cause a ton of swing flaws because it reduces our upper body mobility and makes our movements weaker, slower, and less coordinated. But upper body dysfunction doesn't just cause swing flaws, it can also cause upper back pain a number of different ways. One of those ways is by pulling our shoulder blades into downward rotation. And when our shoulder blades get pulled into downward rotation, it causes our rhomboid muscles to become adaptively shortened. And when muscles become adaptively shortened, they generally become overactive. So we have short and overactive rhomboids from staring at a screen all day. Short and overactive describe how the rhomboid's length-tension relationship has been altered. When a muscle's length-tension relationship becomes altered, that means it has dysfunction, and the body recognizes that dysfunction as an injury and begins an injury cycle. Part of that injury cycle involves the development of adhesions or trigger points within the muscle. So to reduce or eliminate our upper back pain, we need to get rid of those trigger points in the rhomboids, and here's how to do that. All right, so trigger points tend to develop within the rhomboids along the medial border of the shoulder blade. So we can take either a softball, a baseball, a crossball, myofascial release ball, whatever you have, put the ball against the wall, and then lean into the ball, surveying the area along the medial border of our shoulder blades, between our shoulder blade and our spine. We're looking for the most tender spots. Those tender spots are the trigger points that I was referring to. So once we find a trigger point, we just press into the trigger point for 30 seconds to 2 minutes or until we feel a release. The pressure applied by the ball activates mechanoreceptors inside the muscle, which initiates a neuromuscular reflex called autogenic inhibition, causing those adhesions to break up and the muscle to relax. Again, 30 seconds to 2 minutes on each side. All right, so now let's turn our attention to the thoracic spine. Upper body dysfunction pulls our thoracic spine into flexion, and when our thoracic spine gets pulled into flexion, it changes the way the facet joints line up. The facet joints are the joints on either side of our spine that connect our vertebrae together. And if they don't line up correctly, their bony surfaces can't move past each other properly and they get stuck. This is called arthrokinematic dyskinesis. It increases wear and tear on the facet joints, reduces our mobility, and can cause pain. So part of the strategy to reduce our upper back pain is to improve the arthrokinematics, or the movement of our facet joints. Here's how to do that. All right, so this is a posterior to anterior mobilization for the thoracic spine. Survey your upper back, the area between your shoulder blades, with a foam roller and see if you can locate any tenderness on or near your spine. Once you find a tender spot, you can drop your hips to the floor, draw your belly button in, and gently extend over the foam roller, being careful not to extend your lumbar spine. You only want to extend your thoracic spine. Extend your thoracic spine and gently roll back and forth a little bit. Now you might feel or even hear a little bit of clicking or popping. That's totally normal. Those are your facet joints being mobilized. They were stuck, now they're moving again. One thing to note, never foam roll your lumbar spine. Your thoracic spine has the extra support of your rib cage to counteract the shear force applied by the foam roller, whereas your lumbar spine does not. So survey your thoracic spine, locate the most tender spot. Once you find that spot, extend over the foam roller and gently roll back and forth at 1 to 2 oscillations per second for 30 seconds. All right, so this is a rotational mobilization for the spine. You can see that I'm lying on my side. My bottom leg is straight and in line with my torso and head. So there's a straight line connecting my head, spine, hip, knee, and ankle. I have the foot of my top leg hooked behind my bottom knee, and my top knee is resting on a foam roller so that it's level with my hip. Now my bottom hand is holding onto my top knee and keeping it in place, and my top hand is behind my head. Start by trying to touch your elbow to the floor in front of you and hold that position for 2 seconds. Now, remember the rhomboids? They're full of trigger points because they're short and overactive, while the rhomboids retract and downwardly rotate the shoulder blade. But as you roll forward and bring your elbow to the ground, your top shoulder blade has to protract and upwardly rotate, which are the opposing joint actions of the rhomboids. And if we're performing the opposing joint actions of a muscle, that means we're stretching the muscle. So as you roll forward, you're stretching and lengthening the top rhomboid, which improves the length-tension relationship of the muscle, decreases the number of adhesions, and reduces your upper back pain. Now roll back and try to lay your arm flat on the floor behind you and hold that position for 2 seconds. This is where we get the rotational mobilization for the spine. This improves the arthrokinematics or movement of the facet joints and reduces your upper back pain. But let's hone in on that top shoulder blade again and talk about one of the muscles that inserts onto it, the pectoralis minor. The pectoralis minor originates from the outer surfaces of the 3rd, 4th, and 5th ribs and inserts onto the coracoid process, which is a small hook-like structure on the top outside corner of the shoulder blade. Pectoralis minor has a propensity to become short and overactive, and when it does, it pulls the shoulder blade into downward rotation and anterior tipping, which reinforces the compensatory pattern associated with upper body dysfunction and upper back pain. But as you roll back, your top shoulder blade has to upwardly rotate and posteriorly tip. These are the opposing actions of the pectoralis minor, which means we are stretching and lengthening the pectoralis minor, which improves the length-tension relationship in the muscle and helps restore normal alignment of the shoulder blade, which improves our posture and in turn improves our performance and reduces our upper back pain. Complete 12 to 20 repetitions, holding the end ranges for 2 seconds.